A clinical trial has found that weight loss is key for those with type 2 diabetes to achieve remission. The National Healthcare Group's one-year program shows that over 2 in 5 patients manage to reverse their condition without medication or surgery. Now, the number of people living with diabetes in Singapore is projected to rise to 1 million by the year 2050. Rachel Teng reports.
Ms. Wendy Falk was diagnosed with type 2 diabetes 2 years ago. She was keen to avoid taking medication for it as the condition is considered chronic or lifelong. When she heard about the trial, she immediately jumped at it. The first part involves replacing meals with low-calorie drinks before food is gradually reintroduced and regular exercise ramped up.
The first part is difficult because you need to take, when you're told that you only have 3 meals with the meal replacement, liquid meal, then at first you are so scared of from the solid meal to other things that you don't do before. But after second week, then everything become normal to me.
In 18 months, she lost over 10 kilograms. She now cycles to work, sleeps early, and cuts down on junk food. The team found that patients like her, who lost over 5% of their body weight, were over 5 times more likely to achieve remission.
Traditionally, when we manage patients with type 2 diabetes, we tend to focus on the sugars, the blood sugars. And what this study shows us is that actually if we target the weight loss, that actually in patients who are obese and with early diabetes, this actually can significantly improve their chances of actually going into a non-diabetic state.
The program is now in the middle of a pilot phase at Ang Mo Kio and Hougang polyclinics.
Our dietitians follow up with our patients on average about once a month, and what they're looking out for is whether the patient is able to follow the diet plan. They can also monitor for the patient's weight, the patient's blood sugar and the patient's blood pressure.
The program is modelled after a UK study but tailored to Singapore's dietary and cultural context.